In this video, I am discussing about a history that is immunoglobulin A nephropathy. It comes, recall history. The task was 8-year-old girl. Hemoglobin A nephropathy presented with nephritic syndrome. So the features was nephritic syndrome. We know that nephritic syndrome features are hematuria, hypertension, oliguria, edema. And the child was steroid resistant, on steroid deposit being steroid resistant. Can you explain why? Also on enalapril. Why? What is the time frame of developing renal failure? Complications of the nephritic syndrome. Why have complication rates reduced the more recently? So this is an hemoglobin nephropathy present with hematuria clinical features. Normally, we know that hemoglobin nephropathy that is occur just a day after any upper respiratory tract infections, UTI, gastroenteritis. But glomerulonephritis, what happened? It present with week after any skin and pharyngitis infections. That is the different. So first, mm, hematuria, red urine. So we keep in our mind that is what is the history. It can be Hennesculin purpura, post-streptococcal glomerulonephritis, immunoglobulin A nephropathy, sickle cell disease, G6PD, and UTI. So these are the red urine, our possible cases. Now hematuria first history will ask, can you tell me about it? It is red color. Can you tell me more about it? So we know the descriptions when mother tell onset, course, and durations, when it first started. Is this first time occur recurrent? First time it is an immunoglobulin A nephropathy. Remember, recurrent, is it HP or sudden? In urine analysis, it is bright red or dark, dark like Coca-Cola color. Fresh blood urine, we find it immunoglobulin nephropathy. Brown urine, we find it glomerulonephritis. Okay, is it really blood or not? Confirm blood in the P. Then the whole P or beginning or end, at the end, then it is urethral cross. Previous similar any attack, any change in amount, any change in frequency. Then association, is it associated with loin pain, like stone associated with loin pain? Then urine dropping, and before reach bathroom, he pass urine on his underwear, any difficult or burning, crying during passing urine, and UTI. So crying during passing urine, UTI, that is tummy pain also presents. If not confirmed, ask about exact color, feeds, exercise, stain, beat, roost, blackberry, hookup, blood in the nappy or underwear, pain, frequency, identifications, blood pressure, bug in pee, recurrent. So when we ask a hematuria history, we will keep our mind all the DD and we searching them. But immunoglobulin A nephropathy is our history. So here we find fresh color blood, sudden onset in its first time occur, and just after any upper respiratory infections or any gastroenteritis, UTI, it started. Then other concern, any chronic condition, child is suffering, any unusual features. General condition, we ask about fever, weight, activity, sleep, fever, any sore throat, skin bug, streptococcal nephritis before 1 to 3 weeks occur. Immunoglobulin nephropathy 1 to 2 days. Weight loss and Wilms tumor. Here the duration very important because streptococcal nephritis before 1 to 3 weeks occur, and any sore throat, skin bug or fever history present. At immunoglobulin nephropathy it is occur 1 to 2 days. Then we go to the systemic review. CNS details like increased intracranial pressure, headache, weakness, abnormal any movement, gait, vision, and hearing exclude Alport syndrome and speech. So hearing also we ask, it exclude the Alport syndrome. CBS about the payload, racing heart, swelling in the body. Swelling in the body, rheumatic fever, we are asking swelling in the body. Sorry, swelling in the body, that is of renal failure. Any edema present or not, we are asking. Payload, racing heartbeat, because of the hemodynamic status we are searching. Then chest, bug and pain, anxiety about brief, tummy pain, vomiting, and nausea. MSK details, skin spot, describe it, characteristic of HSP. So one of the DD of red urine, it can be Hennesculin purpura. So any rash presents or not, and that's why we describe the skin spots. We know that it is lower side of our body present. Any from the buttock to down. Any other skin lesion like bug infection on the skin, HSP has swelling in unusual area, palm or pinna or ear. Lumps, bone pain, joint pain, hair loss, nail and ulcer, example mouth ulcer. Then endocrine, thyroid, Cushing, diabetes mellitus. Past history as usual 5T IOA. 5T, you know that any trauma history is very important. Any trauma, after trauma, any bleeding occur. Trauma, traveling history, any treatment taking or not, any surgery previously occur, any blood transfusion occur. Then travel with any area contain leak or stagnant water like schistosomiasis, drug sting bite. So going any water area, any lake area, swimming. So schistosomiasis we are excluding. Keep in your mind when you take the history. Parental history brief. Any problem during pregnancy or during or after delivery, abnormal test after delivery, oligohydramnios, any abnormal jelly skin. Then puberty, we asked. Then van is vaccination, allergy, nutrition, diet history, growth chart, nutrition. Did add any colorful artificial color? Example, beetroot. So did add any colorful artificial color like beetroot? We can ask that. If we don't find any positive finding, we ask this. Family history, blood related, number of the children alive and well. Blood related, anyone associated with not hematuria. Then social, psychological, as usual. So what are the differential diagnosis of hematuria? That is false hematuria and the true hematuria. So true hematuria, DD, local causa trauma, like number one, number two, tumor, bladder, kidney or womb tumor, neuroblastoma. Then number three, student hypercalcemia. Number four, infection, that is UTI, malaria, schistosomiasis, HIV, nephropathy. Number five, congenital, that is multicystic dysplastic kidney, polycystic kidney. Six is vascular, that is hematology, renal vein thrombosis, sickle cell disease, hemophilia, HSP. Then nephrotic, atypical. Number seven, eight is nephritic, hereditary, Alport syndrome, autoimmune, post-streptococcal glomerulonephritis, SCD, immunoglobulin nephropathy, and infective endocarditis. Okay. And systemic cause are hypertension, vitamin K deficiency, liver disease, bleeding disorder, drugs. False hematuria causes number one, myoglobin, convulsions, steroid, exercise, malignancy, hyperthermia. Number two, hemoglobin, intravascular hemolysis like DIC. Number three, concentrate urine in dehydrations. Four is drugs, that is propofol, rifampicin, desflaxamine. Five is food, beetroot, blackberry. Six is that is Munchausen by proxy. Then menstruation. DD of hematuria plus skin infection. Remember, Henoscurine purpura, post-streptococcal glomerulonephritis, and SLE. So DD of hematuria plus skin infections. Remember, DD of hematuria plus skin infection, that is the key. Henoscurine purpura, post-streptococcal glomerulonephritis, and SLE. DD of hematuria plus joint pain, then SLE and HSP. SLE chronic condition, HSP acute conditions. So this is all about hematuria history, especially immunoglobulin A nephropathy history I am telling. It comes recall. That's why. Thank you very much.